Hi, my name is Colleen. I have a disease. It's called Ehlers-Danlos syndrome. And because I know there's not a lot of education out there and a lot of people who know about it, doctors tend to ignore the fact that it exists. Well, I don't think they try to ignore the fact that it exists. I think they get 10 minutes of education in school about it, whereas another connective tissue disease that um, is actually less common, Marfan syndrome, gets a lot of time spent on it. So, in my case, it took 41 years. Yeah, you didn't hear me wrong. 41 years to get diagnosed. That's not uncommon. It's frequently misdiagnosed. It's frequently undiagnosed. They just diagnose you with 100 other things, which you have. You have those other things, but they don't look at that broad spectrum, that big picture. What is causing all those other things? If I were to go into all of the education about Ehlers-Danlos syndrome in one video, we'd be here for hours. So, my hope is to just get some information out there. If people are having symptoms similar to what could be Ehlers-Danlos syndrome, help them to find a way to get diagnosed. Give them some literature, some information, some thoughts on how to get diagnosed, or even, hey, look, it might be this. Why don't I ask my doctor about it? So, starting with it's Ehlers-Danlos syndrome, and it is a connective tissue disease. It is a hereditary genetic defect. So you're born with it. There are, I want to say, 13 subclasses, or subtypes of Ehlers-Danlos syndrome. We'll get into those more later. All but one subtype are known to be carried autosomal dominant. Now, if you don't know genetics, autosomal dominant means you need one parent to have one mutation on one gene to pass it on to at least 50% of your offspring. Now, let's get into that a little bit, because people think, okay, so my chances are 50-50. The chances are for each child is 50-50. So if you have two kids, it's not one kid will have it and one won't. Likely, both my children have it, because that's the way my family goes. My parents had 3 kids. So far, I'm the only one who has shown up with it. My cousin is one of 4. So far, she is the only one who has it. We know what side of the family it came from, but I was the first one diagnosed. She was second, because I sent her to my geneticist, because I knew she had a lot of the same health issues. So, in the broad spectrum of things, when somebody says your chances of your child having this is 50-50 because it's carried autosomal dominant, it means if there are 50 families out there. And they each have 2 children apiece. A minimum that equals 100 children, right? So a minimum of 50 children out of that 100 children will have it. Doesn't mean 1 out of each family will have it. It means some families are going to have both their kids having it. Some families will have 1. Some families will have none. My luck would never be to be the one to have none. Because, my life is, one of those type of lives where that's just, luck doesn't exist in my family. We're Irish and we still have no good luck. Anyways, so it is carried autosomal dominant in all but one of the subtypes. Okay. The main signs and symptom that is present and checked for is hypermobility, which means when you hear the term double jointed, which is not a true medical thing, there's no such thing as double jointed. You've got one joint, but what it means is you're hypermobile. And there's a difference between flexibility and hypermobility. Flexibility is I've worked my ass off in order to get my muscles, ligaments, and tendons stretched out enough to be able to do, the splits, or be able to put my hands flat on the floor with my legs together. Flexibility is what gymnasts and dancers strive for. That's why they do all that stretching and, all that stuff. Hypermobility is you're born that way. I stand up and both my knees bend backwards. When I lock my knees, both knees goes backwards, greater than 10 degrees. My arms do it. It's hard to tell. But you can see how it's like this instead of being straight. It's hard to show. That's one of the things they check for is your knees and your arms. Your thumbs, I used to do it all the time. But if you look how close I am to touching my thumb to the inside of my forearm, I used to do it all the time. I've had two wrist surgeries on each hand, and I'm 44 years old. So, arthritis has kicked in. But you can also see it's hard to do with my hands. This is called swan fingers. And if you look like that, it's hard right there, that joint there. Look at how hyperextended that is right there. All of my fingers are like that. My toes do it too. I've also had multiple surgeries just trying to fix my ligaments and tendons in my fingers because my joints end up locking up because of overuse with them. Skin is an issue with EDS. I should have talked about this to begin with. Connective tissue. Okay? The building block of your body is collagen. Okay? It's the glue that holds absolutely everything together. It's a protein. Okay? So all of your connective tissue is made up of collagen. EDS is a hereditary defect of the collagen. So my collagen, it's just not made the same way as a normal person's. And if you think about collagen is a protein, and it's the building block of all connective tissue. Now think about your body. What is connective tissue? Connective tissue is your eyes. Connective tissue is your skin. Connective tissue is your ligaments, tendons, muscles, blood vessels, all your organs, your bone marrow, your brain, and your spinal cord are 100% connective tissue. The discs in your back and your neck are connective tissue. Primarily everything besides the bone itself is connective tissue. Okay? So, well, and your blood really is not connective tissue, but it, carries those proteins and it helps to rebuild those things. So, when I say because of my EDS, I bleed easier and longer and it takes longer for me to heal, it's got nothing really to do with my blood. My clotting is fine, but the collagen and the protein that make those things heal and seal up is not. And so the glue doesn't glue it closed. So it takes longer for wounds to heal. I bruise a lot easier because if I just tap a blood vessel too hard, I can give myself a bruise because those vessels burst. So when I get stuck with a needle for an IV, I have had as many as 10 IVs in one day go bad, not because of the nurses or the people inserting them, but because my blood vessels are so fragile from my EDS that they just bust and then the IV goes bad. And so I end up obviously with a lot of PICC lines. I'm at high risk for just bleeding out during surgery because of that healing time taking so long. Let's see. Other skin stuff. In some of the subtypes of EDS, you'll see people who literally their skin is just saggy and loose. Mine is on my hands and feet only, so you can it tense up like that. The rest of my skin is just, they call it velvet, and basically it feels like the velvet. It feels like velvet. If you go to Joann Fabrics, feel velvet, you're feeling what my skin feels like on a day-to-day natural basis without any moisturizer. However, my skin is so fragile, if you rub it too hard, you will literally rub my skin off. because those layers just come off. Because they can't keep a dressing on my skin for like PICC lines, IVs, wounds, because my skin just lifts off. The layers of my skin just lift off. And so the adhesive just pulls the layers of my skin off without any pressure. Excuse me. And so we end up changing these dressings constantly. And then I end up with big wounds because I no longer have any skin where I should have skin. And, it's a mess. It's a mess. In 2016, I spent nearly 100 days in the hospital over the course of 5 different admissions. That's the next thing I was gonna talk about. It affects your GI tract, because what is your GI tract? Your GI tract is 100% connective tissue. So a lot of people with EDS have what's called gastroparesis, which is paralysis of the stomach or slow motility of the stomach. Some of us, like me, have intestinal dysmotility. My entire colon was removed in 2016 because it was completely paralyzed. And I was full of stool to the point where I was vomiting it up. It's very rare for that to happen, and as a nurse of 20 years, the only other people I've ever seen that happen to is cystic fibrosis patients. And I always thought, oh my God, how horrible that must be. Well, guess what? It is horrible. It is horrible. So they took out my colon. I had a temporary ileostomy for 3 months, which, because my skin lifts off, the layers just come off, they just fall off. My ostomy appliances just kept falling off. I had gaping wounds just from trying to keep the ostomy bags on. And now that my small bowel no longer functions, there's been a couple times I've had to have surgery due to adhesions, because I've had 8 abdominal surgeries. And they've talked about doing partial small bowel resections. And I've told them point blank, I would rather die than ever have another ostomy, because I was in so much pain from my skin. So that is actually on my living will. And my friends are my backups, because my husband, is I don't know. He's the person for the living will, but 2 of my best friends are the backups, and they're both nurses. And they both helped me with this difficulty with this ostomy for 3 months. And my husband doesn't understand why I would rather die than have to fight those gaping wounds ever again. So that's a long story. So anyways, yes, it greatly affects the GI tract. So if you're somebody who is constipated, vomiting all the time, is immediately full after taking 1 or 2 bites of food, is constantly nauseated, my first, well, other than the constipation, my first symptom was that I could throw up food that I ate 5 to 7 days prior to. And I had 3 GI doctors tell me, not possible. Not possible. Well, the problem is GI doctors aren't motility specialists. So they know very little about the motility of the gut. And unfortunately, that does nothing for those of us who have severe dysmotility. At this point, my diagnosis is global dysmotility because my stomach is slow, but not overly slow. My small bowel barely functions. We've talked about small bowel transplant because I've got a couple areas in my ascending aorta that are enlarged. They're not yet considered aneurysms. They're not yet considered aortic dilation, but they're right at that point where, they could get to it. I've got autoimmune disease. I already don't make enough T cells. And when you're talking about transplant and immunotherapy to prevent rejection, T cells are very important. So if I were to take medications to compromise my immune system, my T cells would drop farther, and I get infections all the time anyways because of it, but I could easily go septic. And so thanks to my dysmotility, my diet is crap, and we'll talk about that more another day. I'm just trying to get through the symptoms. Let's see. There are a lot of them. People with POTS, postural orthostatic tachycardial syndrome. There's a huge link between POTS and EDS. It's also known as dysautonomia or autonomic nervous system dysfunction. I'm kind of lucky, I guess, because I have autonomic nervous system dysfunction, which in my case causes sweating, dizziness, passing out, but my heart rate doesn't go up high enough. My resting heart rate's in the 50s to start with. For diagnosis of POTS, it has to be over 120 or increased by 30. Well, with my resting heart rate so low, my heart rate didn't meet the parameters. But I do have significant orthostatic intolerance because my blood pressure, which is low to start with, 90 over 60 is a good day for me. My blood pressure, when I've been in the hospital recovering, no meds, no nothing, already, I'm there just because, I can't eat or I have C. diff or something. At times where I'm actually getting better and I'm normalizing, they've taken my blood pressure and I've been as low as 60s over 30s, 50s over 20s, and I didn't know it. I'm like, hey, can I go for a walk? Can I stay, and I'm sitting down and they take my blood pressure and, oh, no, you can't go for a walk. And they literally searched my room thinking I was taking some other med. And I was like, dude, it's just me. This is not something this has happened before. This is just something that I do. I could take my blood pressure at home watching TV and it would be, 50 over 30 and I'd be, yeah, just like I am right now. So, but autonomic nervous system dysfunction, we'll go through that one day too. My primary goal on this channel is, first off, education, because there's a huge population of people out there that are going through a lot of this stuff and have a lot of these diagnoses, and then doctors are looking at them thinking they're crazy and they're making this shit up, and it turns out that they actually have an underlying cause to have all these diagnoses. It causes neurological issues, causes brain fog. There's a link with narcolepsy, which I was diagnosed with. There's a link with insomnia, which I also have. REM sleep disorder. Just sleep disorders in general. And like I told you before, your entire brain is, guess what? Connective tissue. There's also spinal issues, cranial cervical instability, where C1 and your skull don't fuse properly, and so you're just like a bobblehead, which I think I have, but we haven't. You need a standing MRI for that, and I've already had spinal fusions, so chances are I probably do have it. I go numb if I hit a bump wrong on a road when I'm driving. My arms go numb. Oh no. It's really hard to get diagnosed with the CCI. And then there's also a link with Chiari malformations. Wow, there's so much. I can't even. If you're still with me through this, thank you. I will try to, go through more stuff in another video. And if you come back, thank you. I just really, because so many doctors are uneducated on Ehlers-Danlos syndrome, and so many doctors look in the medical world, and I'm going to tell you, as a nurse of 20 years, I'm now on disability permanently, but as a nurse of 20 years, we were taught to look symptomatically and at the systems, not holistically at the entire everything, not to put everything together. And that was, literally, I walked into the geneticist's office and it took her 5 minutes of, she had already looked at my chart. She says, well, I think I know what's going on, has me stand up, does the Brighton and the Bighton scales and says, yep, you're a 9 out of 9. We'll explain those later. So within 5 minutes of looking at me and talking to me, This woman was able to explain why I had 20 different diagnoses and had already had nearly 20 surgeries. There is a massive population out there right now that has Ehlers-Danlos syndrome because it is a spectrum disease and they may just not be having enough symptoms right now to get diagnosed, or their doctor doesn't know anything about it. And when I say it's a spectrum disease, I mean, at this point, I think the entire world has heard of the autism spectrum. Okay, so autism spectrum, here's mild ADHD. Here's severe autism. Okay, here's moderate ADHD, severe ADHD, mild Asperger's, severe Asperger's, mild autism, severe autism, right? So there are people out there with EDS who have mild symptoms. They're clumsy. I was the clumsiest kid anybody has ever seen, and we didn't know why. My parents, in the 80s were like, God, we need to just put you in a freaking bubble wrap. Because I'm breaking bones all the time. I'm needing surgery. I'm, hyperextending everything and tearing ligament. I freaking herniated the disc in my neck while I was sleeping and required a fusion because of it. Okay? I mean, so there are people out there who just think that they're clumsy and that they have IBS because everybody is diagnosed with IBS and that they just can't sleep because they have some mild, anxiety. And, if they were to look deeper, they'd fit the criteria for EDS. And then there's me, whose gut shut completely down, who's got every neurological symptom, who's had, at this point now, had 30 surgeries, minimum of 10 in the last 4 years. I don't know. Oh, my first symptom, I was born with a broken clavicle and I had a severe tongue tie. And in my first year, in the first 12 months, they had to cut the tongue tie 4 times. Now, tongue ties are not unusual, but having to clip them more than once is. And it is now being found that those kids that need those tongue ties clipped more than once probably should start seeing a geneticist at an early age and get checked out. People with idiopathic gastroparesis, what idiopathic means they don't know why they have it, need to take a long look at their medical history and see if they should see a geneticist. The best geneticists are at children's hospitals, and that's where I got diagnosed, was at a children's hospital. Luckily, I had been working at a children's hospital for 15 years, and I've been lucky I knew the geneticist, and with my kids having symptoms of it, I've been able to, pick and choose who I want them to see and that kind of stuff. But my kids are teenagers and do not want official diagnosis. And I can't blame them because they've seen me go through hell. So I'm going to end this video. Please come back, learn more about EDS, especially if you're somebody who has any of these symptoms. I will go into more of the signs, the symptoms, more education on stuff. As a nurse, as a mother, as a chronic illness sufferer, I'm somebody who researches, and I don't mean Dr. Google. I mean, I research the medical sites because I have a license that allows me to do so. I research the studies, and I discuss at length with my doctors. Also, a great resource is the Ehlers-Danlos Society, eds.com, and they not only have education for licensed medical professionals, they also have education geared towards the layperson, towards patients and patients' families, so that they can understand more. Well, I'm going to sign out. I guess subscribe, and I'll talk to you more later. We'll learn some more together at another time. Thank you for watching.